Susan, it was just the other day that I worked, we were treating a patient who ultimately lost her life to COVID-19. And as a team, we sat there and took a moment of silence for her, to honor her, to respect her, because we knew her family couldn't be there with her. And I even found myself praying for her, because at the end of the day, we're all humans taking care of other humans, and nobody really wants to be in a predicament where they have to die alone. So we stood there with her during her final breaths.
Well, I'm sure her family, if they are watching, are thanking you for doing that. Thank you.
Thank you.
That was 5 months ago, back in April, when I spoke to respiratory therapist Deirdre Finney, a hero who works at Piedmont Hospital in Georgia, saving lives, not thinking of herself, and she is not alone in this fight. COVID is still here, as you know. The death toll in the U.S., more than 200,000, leaving hospital workers to step in to provide emotional support as people pass from the virus again and again, without allowing family members in. Psychiatrist Dr. Angela Arnold joins me now. Dr. Arnold, good to see you.
Good morning,
Your husband
Susan.
is a doctor as well, so you know
Yes.
it is not in the training process for doctors to put themselves first. They're there to do a job, to save lives, and rarely do they think of themselves.
That's correct, Susan. During our training, there's just no time for that. And now we find ourselves in the midst of a pandemic, which none of us have been trained to handle. And the doctors on the front lines are losing patients. We're not accustomed to losing patients as doctors. Most doctors are accustomed to saving the lives of patients. We're accustomed to being able to talk to the families and comfort patients and their families. And this is taking a real toll on doctors and the rest of the healthcare system, because these are things, Susan, this is above and beyond what anyone could ever be trained for.
And certainly the general public, everyone is cheering for the doctors. I believe we have video. This happened in New York, I believe, back in March, April, May, at a specific time, kind of a way to say thank you, people going outside and cheering, and a big hug, if you will. But mentally, Dr. Arnold, what do you think healthcare workers can do? They certainly appreciated the cheers, but what can they do if they need help mentally? Who can they reach out to?
First of all, I think that they have to be aware of how something may be affecting them. The first thing you always want to assess is your sleep. And this tremendous amount of stress can start to affect people's patterns of sleep. And if people are starting to notice these things, if they're turning to alcohol and drugs perhaps to comfort themselves at the end of a long day, it's a good idea to reach out to your family. It's a good idea to reach out to a mental health professional. If the doctor or the healthcare worker is associated with some sort of a church, it's always a good idea to reach out to your clergy in situations like this. There's always been a stigma attached to a physician or a healthcare worker having any kind of a mental health problem. So it might be better to pull that away from your actual work setting. You will probably feel more comfortable if you take it away from your work setting and take these problems to someone else. Then you'll feel more comfortable when you actually go back to work, because you won't have shared that in your workplace.
Yeah, it's always good to think of yourself first. Of course, the patients, I've spoken to many physicians who are putting their lives on the line and say their patients come first. And because this is so isolating, Dr. Arnold, as you know, COVID-19 is, they're not able to see family members. So the doctors have to step in and comfort the patient, and also saving lives. And early on in this virus, not even having the correct PPE to do so. But great advice, going outside of the circle of the hospital and outside of your family, and be aware of how you're feeling. Dr. Angela Arnold, thank you.
Thank you, Susan.